Chapter 13, Therapies. We're going to talk about all different types of therapies during this chapter. Here's our preview. We're going to talk about biological therapies, psychotherapies, socio-cultural approaches and issues in treatment, and the effectiveness of psychotherapy. That link, don't worry about that link. It's not working anymore. So we will just pass by that. Slide 3. Biological therapies. These are treatments that reduce or eliminate psychological disorder by altering aspects of bodily functions. They're sometimes called biomedical therapies because the medical field are the ones who prescribe these types of therapies. Drug therapy is the most common form of biological therapy. An individual can also go through electroconvulsive therapy and psychosurgery, which we will talk about a little bit later on. Slide 4, drug therapy. We have here, this happened in the 20th century, where it definitely changed mental health care drastically. These are the types of psychotherapeutic drugs used dealing with anxiety disorders. They use anti-anxiety drugs, mood disorders, antidepressant drugs, and schizophrenia. They do antipsychotic drugs, which we will talk about each in detail in a second. Slide 5, anti-anxiety drugs, also known as tranquilizers. They make an individual calmer and less excitable. Benzodiazepines, don't worry about having to spell this. These are the most common anti-anxiety drugs. Some popular benzodiazepines are Xanax and Valium. Benzodiazepines are fast working, taking effect within hours after they are ingested. Some of the benzodiazepines' side effects are loss of coordination, drowsiness, fatigue, and mental slowing. Anesthetics, antihistamines, sedatives, muscle relaxers, and prescription painkillers can, when combined with alcohol, lead to depression, so you have to watch out and not combine alcohol when taking these types of medications. Many individuals experience stress and anxiety in their daily lives, and anti-anxiety drugs are routinely prescribed to help individuals cope with their problems effectively. If these meds are overused, they can cause addiction. And then dealing with general anxiety disorder, which we talked about in previous chapter 12, these types of medications they use are non-benzodiazepines. Antidepressant drugs. They help to regulate mood. The three main classes of antidepressant drugs are tricyclics, MAO inhibitors, otherwise known as monoamine oxidase, and then the last one are selective serotonin reuptake inhibitors, shortly known as SSRIs, which we'll talk about on the next slide. Tricyclics are believed to work by increasing the level of certain neurotransmitters, especially serotonin and norepinephrine. Know that. They bring relief to as many as 60 to 70% of the patients with depression. Some of the side effects can be restlessness, faintness, trembling, sleepiness, and difficulty remembering. The MAO inhibitors are not used as often as the tricyclics because they are much stronger. Their interactions with certain foods and drugs, such as cheese and other fermented foods, along with red wine, makes them riskier than the tricyclics. Slide 7, talking about the SSRIs. These work mainly by interfering with the reabsorption of serotonin in the brain. Prozac and Zoloft are the two most widely used SSRIs. Paxil is also used frequently. These two drugs have increased effectiveness in reducing depression and have fewer side effects than antidepressants. Some of the SSRI's side effects are insomnia, anxiety, headache, and diarrhea. Antidepressants have been used to treat various personality disorders such as generalized anxiety disorder, panic disorder, OCD, social phobia, and post-traumatic stress disorder. Lithium is used to treat bipolar disorder. When taking lithium, the amount circulating in the bloodstream must be closely monitored because the effective dosage is close to the toxic level. So we don't want to intoxicate anybody. Lithium is thought to stabilize moods by influencing norepinephrine and serotonin. Slide 8, antipsychotic drugs. Antipsychotic drugs diminish agitated behavior, reduce tension, decrease hallucination, improve social behavior, and produce better sleep patterns. They are used especially in individuals with schizophrenia. Slide 9. Neuroleptics are most widely used of the antipsychotic drugs because they block the dopamine system's action in the brain. Neuroleptics do not cure schizophrenia, they only treat its symptoms. So there is no medication cure for schizophrenia. One side effect of neuroleptics is tardive dyskinesia. Know that term. It's a neurological disorder resulting in involuntary movements of the facial muscles and mouth, as well as the twitching of the neck, arms, and legs. Atypical antipsychotic medications carry a much lower risk of their side effect, tardive dyskinesia. Clozapine and risperidone, don't worry about those terms, are two of the most well-known of the atypical antipsychotic medications. Slide 10, electroconvulsive therapy, ECT, sometimes called shock therapy, is mainly used to treat severe depression. The goal of ECT is to cause a seizure in the brain. ECT is mainly given to individuals who have not responded to drug therapy or psychotherapy. The patient receives anesthesia and muscle relaxants before the current is applied. This medication allows the individuals to sleep through the procedure, minimizes convulsions, and reduces the risks of physical injury. It's quite controversial and only used as a last resort. Slide 11, psychosurgery. Even less popular than ECT. Psychosurgery is a biological intervention that involves the removal or destruction of brain tissue. Its effects are irreversible. One form of psychosurgery is a prefrontal lobotomy. You've all heard of that term before, someone who had a lobotomy, right? Making fun of people. Prefrontal lobotomy, this is where a surgical instrument is inserted into the brain and rotated, severing fibers that connect to the frontal lobe. Thousands of these surgeries were performed in the 1930s and 50s. Many individuals were cured, but others remained in a vegetable-like state. Prefrontal lobotomies are no longer performed. Too many ethical concerns. Slide 12, psychotherapy. We've talked about different types of psychotherapy in the past. This is a non-medical process. Again, we talked before about psychologists, difference between psychologists and psychiatrists, where psychiatrists are the ones with a medical doctor degree, that they're the ones who can prescribe the medications. Psychologists are the ones who do the therapies. They do not have a medical degree. Psychotherapy, again, non-medical process used by mental health professionals to help individuals with a mental disorder and overcome their psychological and interpersonal difficulties and improve their adjustment. So these are the different types of approaches that are included. psychodynamic, humanistic, behavioral, and cognitive. And we'll talk about each of them in detail. And on this slide here, which you have in your textbook, it takes a look at the professional type, the clinical psychologist. They have a PhD or a PsyD, and this tells you the types of training that is involved in there. I'm not going to read all that. You can look at that up yourself. You see the psychiatrist has the medical degree and working its way down, all the way down to counselor who has the degree of maybe a Master's of Arts or Master's of Education, etc. So you can take a look at that in detail if you'd like. Psychodynamic therapies, slide 14. The psychodynamic therapies stress the importance of the unconscious mind, extensive interpretation by the therapist, and the role of the early childhood experiences in the development of an individual's problems. Psychoanalysis, we talked about that before with Freud and how he is the father of psychotherapy and psychoanalysis. So Freud's therapeutic techniques for analyzing an individual's unconscious thoughts. We talked a lot about that before. He looked into your unconscious thoughts. He believed that an individual's problems could be traced back to their childhood experience, many of which were of a sexual nature. And then you have here the goal is to bring these unconscious conflicts into conscious awareness. Certain techniques they use are free association, interpretation, and dream analysis. And we'll talk about those now. Free association. This involves encouraging individuals to say aloud whatever comes to their mind, no matter how trivial or embarrassing. Interpretation is the process wherein the therapist looks for hidden meanings in what an individual says and does. The therapist may suggest to the patient various possible meanings with their symbolic interpretation. Slide 17, dream analysis. Dream analysis is a psychoanalytic technique for interpreting a person's dreams. Makes sense. They believe dreams hold information about unconscious thoughts and conflicts. The manifest content of dreams is the remembered conscious content of the dreams. This is what you remember. When you have a dream, you wake up, the parts that you remember, that's the manifest content. The latent content is the unconscious, unremembered, symbolic aspects of the dream. Going on to slide 18. Transference. This is the process of an individual's relating to the therapist in ways that reproduce or relive important relationships in the individual's life. So what happens is they are transferring their thoughts and emotions onto the therapist. The therapist is taking on a role of somebody in their life. So that's not something that we really look forward to. It's not something that's as beneficial for the client. Resistance is an individual's unconscious defense strategies that prevent the therapist from understanding the person's problems. So in this case, as you see their unconscious defense strategy, if there is something that the therapist brings up that unconsciously the patient is having issues with, then they will resist, they will kind of shut down, avoid the topic, change the topic, something like that. That is resistance. Some contemporary psychodynamic therapies. Many psychodynamic therapists today still try to probe into an individual's childhood experiences. They still do it a little bit in an attempt to obtain information on the individual's current problems. Psychodynamic therapists also try to help individuals gain insight into their emotionally laden, repressed conflicts. There are very few contemporary therapists who still follow the orthodox Freudian psychoanalysis. Contemporary psychodynamic approaches emphasize the development of the self in social contexts more so than in the past, that type of stuff. And you have Cahut's view, Early social relationships with the attachment figures are critical. We talked about the different types of attachment early on in the semester, and the internalized of the relationships are a basis for their self, the perception of their self.